Thank you so much, Chairman, for introducing me, and thank you everyone for joining here. And thank you, ICACS staff, for giving me a chance to present here. I am Jung-Min, Yeungnam University Medical Center in Korea. Yeah, now my presentation issue is emergency surgery in the elderly in Korean perspective. I have no COI in presentation. Yeah, now this time is home 100 times in this 2025. Home 100 refers to the era of the 100 years lifespan. The term home 100 has already have been introduced in 2009, 17 years ago. Yeah, in United Nations classified society based on the proportion of population aged 65 or older. There are aging society, aged society, and super-aged society in this classification. In 2000, Korea had officially became an aging society. 7 years later, in 2017, Korea had officially became an aged society. It took only 17 years from aging society to aged society, while Japan took 24 years for the same transition. Yeah, comparison with Japan is not important in this time. Importantly, and ultimately, Korea entered the super-aged society last year, 2025, in newspaper or statistics. Aging process is a poor condition on the emergency surgery and operating table. The basic question is, elderly is always the same or similar appearance? The answer is no. They are very energetic and healthy and muscular elderly, and the other side, they are very weak or even bedridden state elderly in most of all that we see in the emergency room. As I mentioned earlier, other presenter and Moronoi, the evaluation of the elderly patient is crucial in emergency situation. Based on the evaluation result, including elderly patient function, risk level, and the predictive post-operative outcome, this timing of emergency treatment is adjusted based on these factors. If time is available and the elderly patient is poor condition, time-consuming preoperative preparation must be carefully carried out in emergency room. In practically, careful preparation is known to improve the prognosis of the elderly patient. A decision must be made between careful treatment and prompt treatment. As we know, a careful treatment or a careful decision is needed to time-consuming, but prompt treatment is a possibility of a hasty decision. We must make this decision within the time frame established by the timing classification of acute care surgery presented at the 2023 WSES. The abbreviation is TACS. Various aging process and the changes are poor condition, as I mentioned earlier. In the elderly, there are various poor conditions, including sarcopenia, frailty, organ-specific function decline, and coexisting disease, and the polypharmacy. Especially, frailty is frequently mentioned today's several presentation and so many speakers. Bruno said also a frailty. In addition to this, there are very or diverse other defective factors in the emergency room. To evaluate these factors, as I mentioned earlier, last presentation, comprehensive geriatric assessment is needed. I think so. In addition, we need to recognize geriatric syndrome also. We are familiar with the evaluation organ function, coexisting disease, and polypharmacy, and so on in elective settings. We are so many experience in elective settings, though relatively we are unfamiliar with the frailty assessment. Recently, frailty has become known as a very important clinical outcome factor as well as sarcopenia. Two tools are widely known for evaluating frailty. One is applied frailty phenotype, and the other is the Larwood frailty scale. Especially, Larwood scale presents a mortality of surgery based on the frailty score. There are various validation tools that evaluate the post-operative outcome in elderly, though there remains no consensus regarding the reliability of these tools in geriatric populations, especially subjected to emergency laparotomy. We all know the lessons. Having various options means there is no right answer, and there is no answer of choice. However, our textbook, Savistone, introduced ACSPS, ACS NSQIP, and ACS NSQIP ACS checklist. So I believe that it is proper to using these tools introduced in textbook rather than doing nothing. In practice, we must make a decision regarding surgery, non-surgical treatment, and or palliative care at the emergency situation in the elderly. Based on the text classifications, the patient acute abdomen, and their pathophysiology, we have limited time to make a decision. Such a decision must be made considering careful, prompt treatment trend, indication, rationale, and the latest cutting edges. In addition, the act on the discontinuation of life-sustaining treatment is actually being enforced in Korea, Seok-Hong mentioned. So palliative decisions are being made in consideration of this law. Such palliative decisions are become increasingly common in Korea. For example, there is the acute appendicitis, which is one of the representative emergency surgery in Korea and worldwide. Along with the traditional surgical treatment, indication for antibiotic therapy are currently increasing in the literature. The similar manner applies to the acute cholecystitis. A wide range of treatment options are available in acute cholecystitis, from traditional cholecystectomy and to PTGBD combined with antibiotic therapy. In practice, there are cases where high-risk elderly patients choose to live out the rest of their lives with PTGBD for palliative purpose without further surgery, without removal of PTGBD catheter, because their remaining life is not long. Acute care surgeons may need to make a choice from various options after considering the risk assessment in elderly patients. 잠깐만요. 이게 어디 갔죠? Next slide. Sorry. The aforementioned Korea Act on the discontinuation of life-sustaining treatment has been effective since 2018. Recently, it has become an essential consideration in the field of emergency treatment in the elderly patient. In Korea, patient right to know and the doctor's duty to explain are being increasingly strengthened. In reality, while this trend has positive aspects, but also it has many negatives. This law presents many problems regarding ethical issues in the intensive care unit that Professor Kim In-kyung will present the next issue in this session. As a joke, when I said in emergency room to my patient, now I start to explain your condition, your disease, your surgery. Open your textbook, Harrison or Savistone. But it's a joke, but this is the reality in Korea. We are currently in the era of the preoperative counseling is crucial in emergency settings, especially for elderly patients. Counseling is essential for both patients' right to know and for their families. This is closely linked to the aforementioned law and the increasing number of legal issues in Korea. However, this process of preoperative explanation and counseling is time-consuming. It has been reported in the literature this time consumption can lead to delay in essential surgical treatment in the literature. In Korea, standards for proper preoperative explanation and counseling are aligned, debated with the side of the patient and their family. Various special treatments for elderly patients are being proposed even during surgical procedure performed in the operating room. There are extra monitoring, hypothermia prevention, fluid and electrolyte, anemia, optimal positioning, and anesthetic technique, and so on. These various treatments require the participation of multiple professional disciplines. A special treatment for elderly patients must be continued throughout the post-operative process. In particular, as mentioned in previous session or presentation, critical rehabilitation, including swallowing difficulty and so on, in intensive care unit, and the various rehabilitation treatment at the same time discharge are considered important. These various rehabilitation treatments also require a skilled specialized in geriatrics. A team approach by the specialized personnel is crucial. This team approach has been proven in several meta-analysis studies to lead to mortality improvement, decrease of length of hospital stay, and cognitive function improvement. Yeah, take-home message. I would like to summarize my presentation today as follows. Yeah. Specialized experts in geriatrics are required for emergency surgery in elderly patients. Preoperative evaluation of elderly patients, including assessment of frailty and sarcopenia, is absolutely necessary. Counseling to make a proper decision at the emergency situation based on this assessment and the expertise is essential. Maintaining a good doctor-patient relationship is crucial to ensure the smooth progress of the entire process from the initiation of emergency surgery and to discharge. Yeah, before ending my presentation, there is something I would like to announce. It is the Korean Emergency Society. As I mentioned in Seokyeong Hong, the abbreviation is ICACS. ICACS is the subgroup society of ICACS. ICACS is the mother society of ICACS. ICACS was established in March 2025. It conducted research on emergency surgery in Korea in general. So in this issue, in geriatric surgery, geriatrics in emergency surgery is one of the main focus in ICACS. It held the first symposium in July 2025 last year, and the second symposium will be held July 2026, 3 months later. Save the event, please. We hold online conference every 3 months, and next conference will be held next month, May 2026. Save the event, please, also. Yeah. We also collaborate with other academic society, and CAS is proposing policy regarding to emergency surgery. We are conducting research on emergency surgery issue and striving to publish a paper. We are collaborating with the colleague who perform a surgery and building friendship with them. If you like more information, please search Google, YouTube, Naver, and so on. Thank you so much. I appreciate it.